I specialize a lot in scars and pigmentation, also a lot in collagen and facial balancing. And I want to showcase a result that was really one of my favorite results for a patient who had a traumatic scar in the forehead. So I'm going to go through how I solved that scar, and you can just see that significant improvement over time. Really, this patient, I've been working on her for the last several years, and it's awesome because she gets to keep these results. Her skin looks amazing, and we have really succeeded in making the scar as minimally, I would say, just pretty much close to as invisible as possible. It's possible that maybe there's a little bit of that scar that's still visible there, but to the naked eye, to pretty much anybody, it's very, very hard to see. And this particular patient, she's on camera a lot, so it was a really big deal for her to not have a visible scar like that. And so it was a huge success. Really happy with it. And just with that location of the scar, it was a pretty difficult one to actually solve. So I want to walk you through just how I did this case, and overall just how I do a lot of patients that have similar complaints. In this case, actually, this is almost looks more like a chickenpox scar. It's a boxcar scar, but the challenge is really that it's in a location where you have some movement. So any place where you have movement, like the middle of the forehead, particularly right there where normally those 11 lines are, those frown lines are, you could cause a little bit more tension with the scar, and then the scar can get a little bit wider. So you don't necessarily get like full resolution of the scar. But remarkably, actually, for this patient, mostly because she does a lot of also Botox, or we use Dysport for her and help relax the muscles there so she doesn't have the contraction, we were able to really get a beautiful result here. Ray saying, when do you do phenol peels? So it's really more for very severe scars. It's for thicker scars, not so much for like something like this. This is a mild scar that I would not do a phenol peel on. This is, of course, we were able to solve the scar without a phenol peel, so there was really no reason to suggest that. So you could take a look and see that significant improvement of that scar just disappeared. Jay Dre saying, coming to see you, doc. I love it, Jay. Thanks so much. Let me know what your screen name is, so when you come in, I'll be able to know who you are. What's the difference is what somebody's asking. So there's a scar right there in the center of basically where the 11s would be, and afterwards you can't see that scar. That's the difference. And so it's pretty close to scarless, and that's a really tough scar to solve. So there's a really, really good difference right there. So yeah, this is part of what I do. A lot of times for patients like this, actually, interestingly enough, this particular patient, she originally came to me. She was actually one of my earlier patients when I opened up my private practice, and she was like pretty much like one of the first patients when I first opened the doors for my own practice when I first opened up in Irvine. And she really was more for like facial balancing and more for like neurotoxins. That's what her big thing was, is that she wanted to like help with her wrinkles. She wanted to help with just like some volume replacement. And then what ended up happening is that she got a traumatic scar because she ended up walking into a glass door, and it shattered, and like it unleashed basically this big gash on her skin. And fortunately, most of the rest of the gash healed pretty well, but then there's a scar, and she's somebody who's on camera a lot, and she was really sensitive to that and was really worried about the fact that that big scar was really noticeable, and she just thought that it was just like it really affected her self-esteem. It may seem small to some people, but like to a patient that's on camera a lot, and just really a lot of people have a scar, they have a perfect face, and suddenly it's like some moment like that. You have a freak accident, and now you have like this gash there that you like really get disturbed about. It's really like traumatic by itself too. It's like you see like you feel almost like PTSD just having this constant reminder that you're looking at. And so in this case, it was really stressing her out. So happy to help her out, and years later I still see her, and we do like regularly for Botox or Dysport, and also it's just some collagen fillers for her, a little bit of laser resurfacing, and you can see significant improvement. So this was actually with 2 sessions for this particular patient. We ended up doing a couple different ways. So the things that I did for her is I did a little bit of subcision with Bellafill, and then I also did ablative CO2 laser as well as TCA cross for her. And then I subsequently, the next step, I had it so that it was a lot softer, and then I ended up doing a little bit more laser for her, and then I actually put a little bit of dilute Sculptra for her in the laser tunnel holes, and that's a really, really beautiful improvement there. How much would this cost? I don't know. It's tough to say. I'm not sure what we charged for her. I can't remember offhand. There's a few things that we did for it, so probably a few $1,000s. I'm not sure exactly what that was, to be honest with you. Let's see here. I've had a few sessions of microneedling that caused micro scarring, scars got much worse. So microneedling can sometimes make scars get wider. It can do that, and it's tough actually for a lot of patients, because they get told, like, if this patient didn't know me, she probably would have went to somebody who would have just said, just do a bunch of microneedling sessions, and it never would have really solved it. And in fact, it could have potentially made the scar a little bit wider. And also, one of the things with this patient is that we really wanted to make sure that we relax the muscles, and we do that really regularly. She comes in every 3.5 months. We do Dysport on her, so she doesn't get any contraction over there, and it just really helped out as well. Let's see here. Gabe is saying, I have almost a similar scar on my forehead. Can you do it for me? Gabe, with your skin type, we would have to take a little bit more time. In this patient, she's a lighter skin type, so we were able to go a little bit stronger to really smooth down the edges there. It sort of depends on location of it, the depth of the scar. Certainly, we could try to soften it up as much as we could. Sometimes people also just get like a really robust collagen response. Her collagen response is really good. She is 42. When she did this, when this occurred, I believe she was like 38 or so, 38 or 9. Hi Coco, how's it going? But there was a nice collagen response for her, and pretty much any treatment I do with her, it's just really, it does like pretty rapidly improve her skin texture and improve her skin quality. Let's see here. Lily saying, I missed the question for Lily there. Let's see here. Hearts is saying, how much will this cost for all that? I think I got that there, where I think it's probably going to be a few $1,000s for that one, but I can't say offhand. Can TCA make scars wider as well? Depends on how it's done, depends on the concentration. I've said a lot, but there's a lot of people who do it at home. There's also a lot of practitioners who do it who may not be doing it correctly, and it's possible. But with me, I'm very, very precise. I'm very meticulous of the way I do it, and so it's exceptionally rare. Well, in fact, actually with me it's not. I don't have a case of that, but where at least it's sometimes there's like a small window where for like a few weeks it could look like that, but the scar contracts actually. So it's not really much of a concern, much of a problem if you do it properly and you're using the right concentration. You just really, the one thing is that you do have to be really patient, especially with more deep ice pick scars. One of my patients today, I did a consultation with him, and very, very deep ice pick scars, extremely deep ice pick scars in he's Fitzpatrick 5. So very, very complex case actually that I'm going to ultimately do. And I told him that it's going to take several times. We're doing TCA cross over the course of really 2 years for us to soften that up. And then, we'll get improvement with it, but it's a slow process there. Let's see here. Coco's saying, I have a specific question. What is the difference between Radiesse Plus and Dilute Radiesse? Good question. So Radiesse Plus is actually with a little bit of lidocaine already mixed in there. So it's a little bit dilute, tiny bit, but essentially the way we do it is more for like structure. And it's certainly a thicker product than what we call Radiesse Classic. Radiesse Classic is basically just, all it is something called hydroxyapatite. And essentially that's a calcium hydroxyapatite, or CAHA is what it's called. And essentially it's a really thick toothpaste. You actually could use it for your teeth. I actually use it for my teeth. It does brighten your teeth, just so you know. Just a side note, just actually it's a good thing, a product to use, calcium hydroxyapatite. And what it does is it stimulates collagen production. It's really good for structure. The way I do it typically is I dilute it, though. I do it actually pretty dilute into the skin. And then we can actually stimulate collagen, and also something really important is elastin production. Elastin is something that you could use to tighten skin. So that's really helpful, especially in the neckline. So tech neck issues, super common. I have so many patients, all age groups, that complain of tech neck, and we can help with that. So I love it. Actually, it's really, really nice because we can work on patients, those lines that really happen as you're bending your neck like that, which is really, really helpful for people. Let's see here. Fabio is saying, hello, acne scars, ice pick. So things for ice pick scars. I have a really good case tomorrow. I don't know if he's going to let us share, but if he does, I'll try to do a live video with him. But basically, we could do excisions. We could do TCA cross with that. And we're doing excisions for that patient, and then also a lot of TCA cross. Coco saying, oh my God, there's so much stuff about tech neck. So tech neck, basically, for those who don't know, those are more of those like horizontal lines. They basically are called tech neck because of the way we're looking at computers, because of the way we're looking at our phones. We're causing these creases in our skin, and we're getting these linear lines there. So one of the best things that I like is actually dilute Radiesse for that area, because you could actually stimulate more collagen production. The skin quality does get so much better over time. Really, really wonderful product there. That actually also works for hands, just so you guys know. If you really feel like you have skinny hands, Radiesse, dilute Radiesse helps a lot for that. Radiesse Plus is more for like that structure. You put it like more for like the chin area, for like the jaw area. That's where it works out really well there. Do you have treatments for hypertrophic scars on the nose? Yeah, absolutely I do. Usually I use more of like, typically if it's just true hypertrophic scars, then what I would do is more of like steroid injections there, and then you can use some silicone tape. Sometimes you use a laser, like I use a CO2 laser to really smooth it down. It just depends on how thick it is there. Let's see here. Can you do all this while on a low dose of Accutane? Yes, you could. You could do that for that. Let's see here. I know I missed a few things here. Doctor, how do you treat scar texture versus obvious scars? Well, texture really is going to be more where we would use the laser to help soften that out. But the real true, like deeper scars, sometimes that requires where we go inside and break up the scar tissue. And then the other things are going to really be like TCA cross or excisions, things like that. Gabe is saying, can we use laser-assisted scar repair complex every day after laser for a month? Well, your laser channel holes are really not going to be really open for after about 3 days. So it's not going to help you for that. So essentially what we do is we put a dilute form of either Radiesse or Sculptra, or sometimes a combination of both of those. And we use those through the laser channel holes that we make when we do these treatments. And Gabe, who's done a treatment with us before, is asking if you could actually do that every day. So you can't do it that way because it's not going to penetrate in your skin. It's just useless then. That way it's just going to be a waste of money. But certainly, doing it regularly is going to really help you. And like we'll drill those holes in there and do it really regularly with that. Anna's saying, my skin's smooth, but my acne scars are pink and red in spots. What do I use? Do azelaic acid, really easy option there. Just do 10% azelaic acid. It's probably going to be able to help you out with that. Let's see here. Ruin is saying, Dr. Filler is on my face. It's 1 year and 5 months. Thank you. Appreciate you. Let me one day stop by so we can see the results at some point. It'll be really nice. A lot of times I do so much filler and then I don't see the patients for a long, long time. I would love to be able to show more and more filler results. Actually, it'd be really fun. So I love filler results actually. So it's like, I know everybody gets happy and like kind of move on, but like it'll be nice if we could show it. Utakura Sarah is saying, what works best for forehead acne scars? Sometimes subcision, depends on like how deep the scars are. Sometimes just TCA cross. Sometimes if it's pretty deep though and destroyed some fat, which is easy actually when it's on the forehead because there's not that much fat there, then what you may have to do is a little bit of filler there. So you may have to do something like a hyaluronic acid filler for that. I myself I put Belafil on my forehead, which worked really well. But it's really by the book, really more like hyaluronic acid filler if you're going to do it. Let's see. Araya with the art is saying, what would you recommend for rolling and boxcar scars? CO2, erbium, something else. So rolling scars, really I would do more with manual work. I had a really great case today, really, really thick scars. By the way, if you're on tonight, I hope you're doing well. Did really well with it, like a lot of numbing solution, but I had to use a Taylor Liberator to break up these individual scars. It worked incredibly well for that. And then for the rest of it, where it's rougher around the edges, that's where we actually end up using more of like the ablative CO2 laser and then fractionated CO2 laser blended up elsewhere with that. So helps out a ton actually when you kind of just blended approach and use more manual tools to break up scar tissue. Really, really important to use more manual work for that. I do think that people kind of rely too much on lasers and energy devices instead of doing things that really like use your hands like just properly. And like I love lasers, you guys know I love lasers, but like it's just a tool and there's a way to do it. Like there's a way to do it really effectively. It's just not like the way that people say. Just my patient earlier today that I worked on, he did like 6 sessions of Fraxel. So it's like for his deep thick scars, they did Fraxel on him. It's just so unfortunate, and that's all I did. Do you do deep CO2 only on skin 1 or 2? No, actually, I can even do it some patients, rarely, but sometimes I can do it even on Fitzpatrick 6. It just depends on how thick the scars are, what I'm trying to achieve. Then I can, it depends on what we're trying to achieve. It has to be safe, of course. There's a way to do it, but we could do it that way. Do you recommend Retin-A? All the time. I love Retin-A. Yeah, I've been doing it since I was 16 years old. It's like one of the best things ever, honestly. So Gabe is saying, ever since you did a combination treatment on my face, believe it or not, my face is getting lighter. Yeah, actually, we're revealing your real skin tone. So I love that. I'm so glad that like you're revealing your real skin tone. I try not to get pigmentation, and the way we do that is really by making sure that you're using sunblock, of course, but I use safe laser settings. And on top of it, patients like yourself, Gabe, you do a great job with wearing sunblock and like making sure that you're doing everything else and following the instructions, and you're just going to continue to get better and better results like that. So that's awesome. It's like, it's one of those things that you just like, the gift that keeps on giving, like over time gets better and better and better. It's really, really cool. There's some other patients that sometimes come on here and you'll hear them say the same thing like that. They'll say that like, it just got better and better. Let's see here. Run is saying, doctor, how can I deserve it natural? She's saying, doctor, it was very natural. Thank you so much for the filler. Thank you. Appreciate you, Rune, for telling us that. Let's see here. Anna saying, doctor, can you share with us what you had done? So yeah, sure. I mean, I'm a big believer in a lot of things I push on here. So it's like, I've done pretty much everything. So I did a lot with collagen stimulation. I've done a lot with lasers, and things I've done basically, I've done Bellafill on the forehead, Bellafill on the temple, Bellafill on the cheeks, Bellafill on the chin, jaw, also a little bit of dilute Radiesse too. So I did all those. Actually, it helped a ton, actually, really. It's like, it gave me like the structure I was trying to get back, and helped me revealed basically back to the way I was. I think enhance certain things, like enhance certain features, which I was really happy with. Here and there, I do a little bit of disport, like a little bit on the crow's feet, and a little bit on the frown, kind of due for that. Actually, I haven't done that in like several months, but at some point I'll get a little time to do that. And I'm really due for a laser, so I may do that tomorrow, actually. We'll see. You may see me crusted on Monday. We'll see if I can do it or not. Let's see here. Coco saying, I missed the thing here. What do you think of alt therapy? I don't love it, honestly. Sorry, I don't really love it. I've seen people that it hasn't been great for. I don't think that's really the best. BV is saying, at what age should we start Botox? Whenever you have like that contraction, really. When you have that big contraction of the muscle, then you can consider doing it. I think it's really only like FDA approved really for 21 or over, but it's really at that point you could consider doing it. Let's see here. Do your patients need to do Cosmelan pre-laser treatment? No, I think that would be a little bit too aggressive pre-treatment. Maybe you could do something afterwards, but a little bit too aggressive for me pre-treatment. The way I do pre-treatment works perfectly well. I don't run into any pigmentation issues the way I do it, and I don't go too aggressive like that. And I know people that do those type of things, and actually sometimes I treat their burns afterwards. So I don't think it's probably the best idea for people. What's a better alternative to alt therapy? It's used a lot in Korea. What kind of concerns do you have that you're trying to use alt therapy? I think that's a question there. How do you treat papular scars on the chin? I do a lot with that. Usually I use a small surgical handpiece of the CO2 laser and just keep drilling down there really meticulously. Works very, very well for that. Let's see here. I missed a few questions here. So what can I do for ptosis? Only surgery? Yeah, really it's only surgery. That's all you could do. Life with Glenda. If you travel from out of town, would you do a consult and treatment the same day? I'm 5 hours away. No, better thing for you to do if you're 5 hours away is to schedule through my page. Just go to drqazi.com and then set up a virtual consultation, and then we'll be able to happily go through just the case and see what we could do. So that way you're prepared before you come in, and then we'll usually, before for scar treatments, usually I prep your skin before I do it. So that's typically the case. HJ is saying, how do you treat hyperpigmentation around the eyes? It looks like this. So I do pico laser. It works very, very well for that. Pico laser just goes slow though, but it works incredibly well. How did I remove the scar in the photo? So great question. So those just joining us, I'm Dr. Qazi. I'm a skin restoration specialist in Newport Beach, California. And one of the things I do a lot is scars. In this particular case, this is actually, it looks like it's a boxcar scar. Maybe people would think this is a chickenpox scar. This actually was a traumatic scar on this particular patient. What I ended up doing for her is I actually did a ablative CO2 laser. I also did Bellafill over there in that spot. And then I also then did a little bit later, I actually did a little bit more CO2 laser. And then I did also, the first step, I also did a little bit of TCA cross that day too. And through the laser channel holes, I put a bit of dilute Sculptra. Let's see here. Okay, so I missed a few things here. Mevesh is saying, do you prescribe melanin blocker medication? Yes, you absolutely should do that when you're doing these treatments so that you don't get rebound pigmentation and don't have problems with that. So absolutely, yes, I do that. Coco saying, I'm literally booking my session. I hate my under eyes and don't want fillers. So you're doing PRP, Coco? So PRP is actually great, actually. PRP is great for the under eyes. A lot of younger patients are doing it more for like preventative. They're basically doing it to help prevent issues in the future, just improve the skin quality. And it's actually really amazing for that because, you know, for a lot of people that aren't necessarily candidates for filler, but they want something that's going to like refresh that under eye area, the PRP actually could be a really, really good option for them because it's going to basically renew that skin. It's going to essentially help with the blood flow over there. Skin just looks brighter and better. Hi, saying, can I come in to see you if I have active acne? Well, if you're talking about for our acne portion of things, yeah, absolutely. There's a lot of different things that we could do for acne. We do pretty much the full gamut of treatments for acne. You guys know I suffered a lot from, I didn't have as terrible of scars, but I had really bad cystic acne at one point. And so I went through like pretty much every single thing. I know really the protocols to use for acne. And if you really do have really true cystic acne, there's options really we could do isotretinoin or one of the things that people are really loving at this point, which is the cure laser, which is very similar to Accutane, just normalizing oil production on the face without other side effects to the rest of the body. So it just normalizes that and knocks it out, and it works incredibly well. Galvez is saying, what technique do you use for acne scar and average cost for it? So most of what I do for scars tends to be more manual type of things like TCA cross, subcision, things like that. Otherwise, it just depends on what kind of scar you have. Sometimes it's just, if it's relatively superficial, we could just do a laser or other treatments, but I guess I have to see what kind of scar it is and how deep it is. Rune is saying, how can I remove filler in a natural way? I don't like it anymore. You could do hyaluronidase is an option for that. So hyaluronidase basically you could do actually for hyaluronic acid filler. And I do a ton of it. I actually did a really good case today. This patient actually had done some filler overseas, did it in Brazil, I should say not Brazil, but a separate continent, and in Brazil and in Colombia as well. And they use certain kinds of filler that we don't have over here. And some of it was just very, very puffy. So when I looked under ultrasound, actually it turned out that it looked like she had gotten some Bellafill and she wasn't even aware of that somebody had injected Bellafill, but there was also a lot of hyaluronic acid in there as well. So with the ultrasound, I just went into those little pockets of hyaluronic acid and just directly dissolve those little pockets. It works incredibly well. I dissolve every single day, actually. Every single day I dissolve patients. It's really rewarding. Actually, you see like, people are so concerned about this and they're worried about dissolving. But when they see that improvement afterwards, they see that they can see it seeing their natural face. It's really, really nice. It's really rewarding. And I'm really kind of tired of like this aesthetic that people have pushed on our patients in this world. And it's like really unfortunate that people are puffing up people so much. And, they have overdone it like this absurd amount that they've insisted to do, the mid-cheek fat pad and like making them really blown up and really unnatural. And people were just shoving so much filler into the nasolabial fold and into the piriform space, and they're just insisting that this is the way to do it. And now we see the consequences where it just ended up being like overstuffed, overfilled people. So really unfortunate, that I had to go down that route. I've always, you look at my work, look at my patients, it's like always been very soft, very natural. That's the way I've always liked it. I told people that kind of train with me, things like that. We have a resident with us right now that it's really difficult to go back to the natural form if you're really known for being like a puffy type of person. If you're puffing people out, like nobody's gonna like think that now like you're going to a natural thing that's like true, that's your real aesthetic, because they're gonna be worried you really are gonna suddenly just shove too much filler in there. And I think that there is a problem because people were just really incentivized to overfill, by the companies, and just there was incentive really to push so much product on people. And the results is kind of out there now. So it's too bad, because I think filler done properly can look beautiful. The structure of it is really, really wonderful. It has to be placed down deep to the bone. A lot of times the way that they were doing with the cannula and shoving it with the cannula everywhere, it was really problematic. And now, I hope the more people could be aware that there's a good way of doing filler. You can't just throw it all out. Sometimes you have volume loss. We could do it properly. Let's see here. Clean Record saying, what do you recommend for pitted and rolling scars post-Accutane 2 months? Nose, cheeks, forehead. Likely it's going to be TCA cross, maybe laser. Let's take a look and see what we do. Maybe even excisions. Let's see. Gamby saying, have you worked with deep ice pick scarring fully covering the body? I'm so embarrassed. I'm sorry that happened, where it's covering your full body. Which part of the body are you referring to? Like you're saying full body, but which areas is it occurring in? Let's see here. I guess it's a monkey. Can you improve deep ice pick scars? So yeah, we can improve deep ice pick scars. It's just slow. It's very slow. You have to do excisions sometimes. You have to do TCA cross. It's not something that's overnight type of thing. What is best for jowls? Jowls probably going to be surgery. It's probably not going to be a way around that. Sorry, that's the truth. Let's see here. Dysport or Botox? Honestly, Dysport for me. I'm totally unsponsored, and I've tried everything, and except for Daxify, but I'm not sure. I haven't, I'm not sure about that, but everything really else. And Dysport's amazing. It's awesome. And Daxify, the reason why I'm trying to kind of whatever about it is because it really, when they did the studies, it really just showcased that you just used a higher dose of Botox, and it's basically the same effect. And I kind of do that already sometimes for some patients, like the select patients they want, where it's a little bit stronger around the crow's feet, we could do that, and it's going to last longer that way. So it's basically the same as Daxify, which is so much more expensive. What's the surgery for jowls? So basically there's two options. Basically we could do internal heating, something called face tight, and which will help actually tighten the skin. Or the other option is actually for the fuller, if it really is truly that the muscle is displaced, the fat is displaced, then really do want to do more of a facelift and a neck lift there. All the best is saying, what kind of skincare can I do in the daytime during winter for oily skin? Mostly for that, really, honestly, it should be more just moisturizer. Just do that moisturizer. A lot of times you actually have excessively dry skin, and because people overly exfoliate, and so stop the excess exfoliation. So don't use physical exfoliants. At my day, we were using an apricot scrub, which was terrible for my face, absolutely just awful. And I was scrubbing it, and the mechanical motion of that was really terrible for my skin. And I didn't know anybody. Everyone was telling me to do apricot scrub, so I tried it. For throwback. So people that are older know that was what I did. What we used to do was everybody used to talk about it, about apricot scrub. I was going wild about that. And instead, do maybe a chemical exfoliant once a week during the winter time. So something like a glycolic acid once a week, Paula's Choice is good. There's other ones out there, but whatever you want to do. What I think about Dermalogica exfoliating scrub. So that's the thing. I don't like physical exfoliants. I don't like it. I don't like any of them. Therapist basing. I remember that scrub. Yeah, it was terrible. It was really terrible. And part of what they were saying to do was I should go really aggressive with things too. Really bad for your face. But I pretty much tried everything, every single thing like that. And I think people really over exfoliate. My other patient today, she was saying that she's breaking out and she's doing benzoyl peroxide twice a day, and that could potentially be causing you to get rebound oil production, because essentially what ends up happening, your skin is super dry, and then you produce a little bit more oil then after that. So that's sometimes happens. And so you have to suppress that. Jessica saying, my skin was so good back when I used apricot scrub. Really, Jessica? I don't know. I tried that many times. I never really got good skin with that. But maybe you have different kind of skin. I'm not sure, but I didn't try that. Let's see. What do you think of Paula's Choice BHA? I think it's good. I think Paula's Choice is a good line, actually. I do like it. MILF Mama Jax. Okay, that's a funny name. My left eyebrow split and scar from above to the eyelid. Could you remove the indent? Possibly. I'll have to take a look and see if we could help with that. Is PRF worth the hype? I don't see much of a difference between PRF and PRP. I haven't really had much of a difference. I used to use PRFM. Never noticed much of a difference, to be honest with you. What do I think of La Roche-Posay? It's I think there's a lot of options out there. It's fine, but I think there's a lot of options. What can you do Accutane for mild acne? So what I usually do for that is more of just a low microdosing. If it's just mild acne, if patients want that way, you could do it just a couple of times a week even. It does help actually. We could do it that way, and potentially other days we could do like a topical retinoid. There's a certain protocol that I would use for that. And if you're a candidate for it, that could be a great option for you. Other options really could also be something like I was talking about earlier, which is going to be more of like, possibly the Cure Laser. The Cure Laser works incredibly well, normalizing acne without the oral medication that Accutane is, and without any other side effects. So it works really, really well for that. Let's see here. A surgeon cut out my chickenpox scars, but it looks like a longer scar. So maybe it's a little thinner, more narrow scar. Is that what you're referring to? So basically now you should just laser that and just smooth that down a little bit there. Let's see here. Stay True saying, vitamin C serum, what are your thoughts on it? Is it okay to use after doing the Cure Laser? It may be okay. I'm not like a huge vitamin C person though for acne prone skin. I think it's a little bit too irritating for acne prone skin. And so I probably would wait just a few more months before doing it. You're probably not going to change too much just in those few months anyway. So that's kind of my take on that. What are my thoughts on beef tallow? I know what are people's thoughts on beef tallow? I had a poll about it a little while ago, and a lot of people said it broke them out. So I haven't used it myself. I'd be worried about it, myself. Some patients said it broke them out. I had a patient today who said he liked it, but then he also said he was still breaking out and was getting oily too. So I'm not sure. It's tough to say. I haven't played around with it myself or tested it. I didn't really want to cause like some breakouts and then I try to explain to everybody why I'm breaking out right now. So sometimes I do like try things out a lot, but now that, it's like, I feel like not doing that as much anymore. But maybe, I'll give it a shot with beef tallow. If anybody here has tried it, let me know, message me or put it on here in the chat. What did you guys think? If you have acne prone skin, you tried out beef tallow. All I know is that like I was looking at it, some of the stuff was just sort of questionable, honestly. Some of the things were like, as I was watching it, like these TikToks, they were like pushing like their Amazon affiliate links and stuff like that. And it was just, I don't know, to me, it was just a little bit suspicious that suddenly it was like everywhere and everyone's just pushing these Amazon affiliate links and and pushing it on TikTok Shop and everything. I don't know. To me, it was a little bit sketch too. But maybe it's not. Maybe it's okay. I did a poll. Maybe I'll do another poll one day, and we'll see kind of what people think about that, and we'll kind of see. User 91 is saying, "Are you offering Verporfit?" I'm still waiting for the FDA, but maybe there's going to be changes with the whole FDA thing too. I'm not sure. Maybe there'll be stuff that we could kind of push a little bit better, and maybe like next year. I'm not like confident in any of that stuff, but like maybe I'll be able to see that, and it'll be kind of cool if we could get them to push giving us a waiver. I'm not saying like anything about that, but I do like the fact that all these people are kind of talking a lot more about like the problems with the FDA. I kind of like that. Like I don't agree with a lot of stuff that the guy says, but like I do like the fact that like people are open to like kind of the questions about that, and it's good because I think we should be wondering what's in our food. Honestly, there's a lot of stuff that's in our food. It's like a lot of the question marks with a lot of things there, so it's like I kind of wonder, and then but the thing is though, the same people that are kind of questioning that stuff sometimes, they're also like talking about deregulating like the meat industry. Now we have this whole listeria outbreak everywhere. We have so many times it's like, and listeria could be deadly for pregnant women, for their fetuses, for their babies. So it's terrible actually. So it's like there's like this deregulation that occurs also with like the industries like that, which is really, really concerning too. But really, I do want to like look at all these things. I talk a lot about that maybe we should look at this stuff. Maybe we really should look at like, some of the questionable habits that these guys are doing. And a lot of the things, by the way, just kind of as an aside, just now I'm talking about it. But, I've talked about this in the laser industry, but there's a lot of people that are on their advisory boards who actually also are within pharmaceutical companies or with like the food industry, like literally like with them, like proper, like they're also like executives on the food industry and stuff like that. So how is it that like these guys who are on these advisory boards are allowed to be also on in this corporate world, part of like the pharmaceutical industry and part of like the food industry? It's pretty wild actually. It's I think that there's a lot of question marks with a lot of different things, and hopefully maybe some of that stuff kind of gets out there a little bit, because like I've known about it in my industry for a long, long time. And then like, some family members also have always been talking about like the food industry and things like that, and kind of like pushed aside. Now, like I look at it so much more now. It's like, man, there's so much problem in our food, actually, so much problem. And why is that actually? Why is it just allowed like constantly? So I think it would be really good for us to kind of investigate all that stuff. And one day we just open that. Let's see here. You have too many comments. How much is a consultation in Newport with you? It's $100 for the consultation, actually. Melissa's saying, for pitted acne scar laser, do you get better results the younger you are, or does age matter? Well, it depends. Obviously control your sun exposure. Don't smoke. Things like that are going to help. Being younger could give you a faster response, but you still get excellent results in even older patients. I have a 70-something-year-old patient that I did recently. She has an excellent, beautiful result for deep ice pick scars. Worked incredibly well. Your thoughts on facelift for acne scars that stretch? It could be a good idea. If there's loose skin, it could be a good idea. Do that maybe with a little bit of potentially like fat transfer, something like that. Sailor Moon saying, it's refreshing to have such sweet staff that actually help you answer your calls the first time. Appreciate you. Thank you so much, Sailor Moon. My staff really is amazing, actually, really amazing. And I really say that, like, I know a lot of people say those type of things, but actually, to be honest with you, if you like look at their you like talk to their staff and like meet them and things like that, like you'll see that they're like, people are saying that they're amazing, but like, some people just kind of like draw in a certain kind of people, and it's kind of, I really like it. Like I wanted like a safe place. I wanted people with like acne or scars or pigmentation, or what, like just like they wanted more facial balancing. I wanted them to feel really comfortable in my space. I wanted to, like, I hated actually myself when I went to, I'm kind of over time right now, but I'll go through a little bit with it, that when I was going through my journey, I went to a plastic surgeon in Chicago, and it was so like plasticky, it was like very, very plasticky, very, very salesy. And I felt really weird there because I was going there really for my scars. I was trying to get like some improvement for I was actually only like 22 years old, and I was trying to see if he could do sculpture on me because he advertised on his website, and it turned out he never even did it actually. And he was trying to get me to do like Botox and filler and like a bunch of stuff for like under my eyes, which was not even my concern at all, and talking about how hollowed out my eyes were. And this dude, like I've talked about before in here, but like this guy, he still works today to this day, and he's always like posting stuff like philosophical things, and it's like, man, this is that guy. That's how he made me feel. Like he saw like dollar signs on me, and like just pointing out a bunch of random stuff that I wasn't even there for. I was actually, interestingly enough, like pretty interesting when you actually think about it. I was just young, and I just thought I wanted something a little bit longer for me, and I didn't really want like hyaluronic acid filler. I was worried about that kind of stuff, even though it's relatively new. I just thought it was a little bit concerning, and I wanted Sculptra, and the dude advertised Sculptra. So I went there, and it's like a plastic, like everybody's plastic, and then like they hand you like this quote that's outrageous, and it's like it's like handed to you, and it's like just like sort of like, I don't know if you're old enough, but like the Abercrombie sort of rebranded, after like their whole like sexual assault stuff too and everything. They rebranded quite a bit, and so it's like, but back in the day, you go to Abercrombie, and it used to be like they would be like kind of like the cool kids and like act like really cool with you, and like you would have to kind of try to impress them, sort of thing. Like that's the kind of style that they wanted, and so many plastic surgery offices did that too. It's like they wanted, so it's like they have this look that like, oh, you were too good for you kind of thing, and I just like hated that. Like I literally hated it. I was like, I'm just never gonna do that. That's just never gonna be me. And I wanted, so it's like people just like don't pick at people. People are coming like vulnerable, and it's like everybody knows that. Like all the team knows that that's the thing that we just wanted to support people. It's like, it's good. You could do it. It's like achievable. And I think that's like, it's interesting how people pretended all my life, all these people around us, all these guys in the conferences and everything like that are talking and talking and being sponsored by all these companies, and they pretended as if this is a style that you had to do, and it turns out you didn't have to do it, and you could still do really well without doing that way, and without being like like an evil piece of, and it's just like, it is evil. Honestly, it is evil. Like you're picking on someone who's vulnerable coming to you like that, and it's just like talking about my under eyes and all sorts of stuff. I wasn't there for my under eyes, dude. It's like, why are you telling me at 22 years old? I actually still to this day, Botox out of me, I hardly have any like real wrinkles. I hardly have movement on me. And why are you talking to me about doing Botox and all sorts of stuff like that? And like, because it's just like, that's what they do. So I wanted the opposite of that. Because like I saw it, it was just like, man. But there's some people who go through that, and they're looking at that, and they're like, man, this is awesome. This guy, this plastic surgeon is making so much money, and I'm going to try to do that kind of thing, and it's terrible. And like that's like the difference. That's the divide in this world. So everybody thinks there's like a left and right divide. It's not like a left and right divide like that. There's just like this divide that of like these ethics, and really, it's like, to me, it's more about like, like people that kind of appreciate that you could do things properly and ethically and continue to improve people's lives. I was telling someone today, I was like, what would you do if you just had, one of my patients, I was working on his laser, and I was like, if you just had all the money right now, would you still do psychiatry? And he's like, yeah, I would do it. Like I would still do sometimes, and I still love it. And the truth is that actually I would do what I do. Like it's actually pretty cool. And there's actually a lot of people like that. There's a lot of people who would still do things like that. They would still like try to like give something or like improve somebody and like do that, even if you had the money. Maybe you wouldn't work as much. You would try to have more of a balance, things like that. But like a lot of people are out there. There's a lot of people who just kind of want to build things or grow things or like improve things and like look at the world and think maybe there's something I can kind of help with a little bit over here and do something like that and leave a positive, lasting impact on somebody. And that's pretty cool, right? There's a lot more people than people expect. Everybody tells you, all these guys like Adam Smith, all these guys told you that like everybody's just greedy. Like Ayn Rand has like books and books about that, like greed, and be selfish. And like the thing is, they're the ones that are selfish. It's like actually a lot of people actually aren't really that selfish like that. Like, yeah, we want what's ourselves. We want to be comfortable. We want to be like safe and protected, all those things. But we actually also look at things and like think like maybe we should try to improve like the world a little bit too. Like maybe we should look at things and like see like if there's something I have, a tool that I have that I could kind of give back to somebody or like something I could teach somebody, maybe I'll do that. Even if I was comfortable and had all the money, I would still do that. There's a lot more people than people realize actually. And that's actually why there's actually going to be a lot of change in this world. That's what I think. I really do believe that, because despite what everybody says, all the hopelessness out there, there actually are a lot of people who do want to do positive things in this world. And it's pretty cool actually when you actually like kind of dig into it and sort of just separate the people that are just sort of like, just picky and predatory type people, and just separate those out from like everybody else. And then it's like you start kind of dividing the world that way. And now you have actually a pretty cool world. And it turns out that the people that were kind of predatory, they're actually pretty small. And they just sort of like have a loud mouth and sort of talk a lot and have more money and things like that. And so they push it. They act as if this is like the natural order of things. But it turns out it's actually not. Like a lot of people actually, if you actually ask them, like if you just were comfortable in life and just had a lot of money and like everything was okay, wouldn't you just like, what would you do? And a lot of people are like, I would just like help out people. I'll work with things. I'll do things. A lot more people than you expect. A lot more people. And they really do. And I really believe that they would do it. I do. I think that they would. And call my name, but actually, I really do think so. And I think there's a lot of evidence that it's the case, because like people exist like that. I'm actually over time. I know there's a bunch of questions that I kind of missed in the last few moments there, but if there's anything pressing, I'll let you ask one last thing here. Okay, here we go here. Hairable is saying, having ice pick scars, but hearing conflicting thing about microneedling being good or bad, making the scars worse. It's confusing. It's definitely not going to help much for ice pick scars. So flat out, just walk away from whoever told you to do microneedling for ice pick scars. Sorry. That's not going to help you. If you're doing microneedling, if you're like a practitioner who does microneedling for ice pick scars, sorry, that's not. You should just do a different business. Do something else. Like come up with a different way. I'm telling everybody. I'm going to tell the whole world not to do microneedling for ice pick scars. It's not going to help for those ice pick scars. So do other things. Come up with a better treatment for something else. Anyways, guys, thank you so much. Appreciate you all tonight. I will help you out, or I'll talk to you again on Monday. I have really cool cases tomorrow, so I'm going to sign off for tonight. And